What midwifery means in terms of the word midwife means with women. One of our biggest roles is to support and educate and be present with women when they are experiencing these transitions of life.
Well, I think what we're most recognized for, obviously, is pregnancy and birth, and the general population doesn't realize that we're actually trained to provide well-woman gynecological care. I love working with teenagers, with adolescents. We love teaching them. It's a lot of emphasis on education. And likewise with menopausal and postmenopausal women, helping them to make the transition as gracefully as possible and recognizing the normalcy of menopause and giving them support if and as they need it.
It means a certain sense of security, a sense that I can discuss aspects of myself from top to bottom in a way that could be understood.
Based on my experience, it means like some security, some comfort. It means kind of a relationship, being able to trust someone with your body, yourself, and also your child,
Right? Midwifery to me means somewhat taking some of the aspects of the doctor-patient relationship that I'm not a huge fan of, sort of taking it out of the equation, and it just naturalizes the whole experience.
When you have a baby, you're going to the hospital not because you're sick. You're going to the hospital because you're about to give life to a child, and I think that's the reframe that I think a midwife can give you, is that this is a very natural experience.
I think what a lot of people don't know is that you can see a midwife and a doctor interchangeably for any of the sorts of issues that you would go to your OBGYN for as you get older.
In our practice, we work side by side with the physicians, and there's such a sense of mutual respect so that we come together to enhance the care of the patient, and it truly is a team approach.
We had a great experience in Southampton Hospital with the midwives, and I think one thing that really attracted us to that practice is that the midwives also work in partnership with the doctors, so that we could have the midwife experience and have the backup of the doctors in case there was something that didn't go right, or there was something that we needed their support for as well.
To me, midwifery is about listening to women.
That is a very big issue, having enough time to be heard. And when you're older, it's hard to be heard sometimes. So that I found this a wonderful instrument for my own emotional survival.
And the experience was wonderful, having a midwife guide me through my entire pregnancy. She was very personable, she was very concerned about his well-being, of course, and she just made me feel comfortable.
We most immediately, they were very helpful with thinking about contraceptives. We have 3 children, and we're kind of at our maximum. So, and that was also a really great experience to, both bring life into this world and also, consider me and my age and, the family that we already have, and just to talk to us about the options.
I think being a woman and being helped by women is very important at this stage, being aware, totally aware of what's happening for me, with me.
I think it's just really important as we move forward in the changing healthcare environment to include the idea of choice for women.
It's all about supporting women's choices, so it's informing them of what their options are.
Ultimately, for a woman to have a choice of providers serves her in the most critical time.